You're watching Local 7 Lifestyles with Laura Kirtley and meteorologist Ron Rhodes. This is Local 7 Lifestyles.
Welcome back to Local 7 Lifestyles. September is Healthy Aging Month. It's a month designed to focus national attention on the importance of seniors taking personal responsibility for their health. And we are joined this morning by a very famous actress here, Diedre Hall. She joins us in honor of healthy aging. She is also joined by a special guest as well, Dr. Matthew McCumber, and appreciate you both speaking with us today.
Hi, Laura. It's so nice to be with you this morning.
Good morning.
Well, you are here and you're talking specifically about the importance of vision care, because so often it is overlooked, but it is something that can really change the way someone ages. If their vision, starts to decline, it can make the aging process much more difficult. And do you want to maybe start off and just explain a little bit what you're here to talk about, this particular condition?
Well, age-related macular degeneration, or AMD, is actually the leading cause of blindness in older Americans. And we're going to talk about that today because it is so important. And in fact, we can often treat it if caught early. It starts with no symptoms around age 55 or so, and then it's age-related. So the older we are, the higher the risk of vision loss. If patients start experiencing blurred vision or distortion in one eye, that could mean that it's becoming the more severe wet type of the disease. And that's where we really have to treat early so we can stabilize or restore vision.
Well, and Diedre, I know that protecting your vision obviously is something that's really important to you. Do you want to talk a little bit about why you are speaking out in particular about AMD?
Laura, there are several things going on. First of all, I'm one of the first to enter the baby boom, and at 65, there will be 10,000 adults a day turning 65 for the next 20 years. So it's a huge risk factor. I watched my mother eventually lose her sight to AMD, and the tragedy is that after raising 5 children and working a full-time job and retiring and settling down to do the things she loved, which were playing bridge and knitting and reading, those things were all taken from her. And when she went through it, we didn't have an awful lot of information about it, but now we have a lot more, and it's a treatable disease.
Well, Dr. McCumber, could you talk a little bit about some of the, the symptoms that people maybe would be experiencing that would maybe lead them to go to their optometrist? Maybe talk about some of the, even the vulnerabilities that people may have.
Right. So early on, there may be no symptoms, but we do know the risk factors. So if you have a family history, in particular if you're a parent or a brother, sister has lost vision from AMD, very important to have an eye exam. We recommend a comprehensive eye exam by age 40 and then periodically after that. Now, the risk factors include cardiovascular risk factors, so quit smoking if you can, control high blood pressure, high cholesterol, eat a well-balanced diet. If you know you have macular degeneration, then a vitamin and mineral supplement can slow progression. And then if you start developing the symptoms again, such as distortion or blurred vision, you really have to get into your ophthalmologist and then subsequently your retina specialist for treatment as early as you can.
Yeah, really important tips, and something that, like Diedre, as you were saying, a lot of the baby boomers maybe haven't thought about yet, but this is something, protecting your hearing and protecting your sight, so important as you age. And Diedre, do you want to talk about some of the steps you're taking to protect your own eyesight?
I take vitamins and supplements. I exercise. I do not smoke. I'm cautious. I have exams every year by a retina specialist because I'm at high risk because I'm a mother. And then just being sensitive and aware of changes in my own eyesight.
Well, so important. Is there a place where people can go to get more information? I mean, obviously they can speak with their doctor, but are there links out there, websites maybe, where people could go if they are concerned that maybe they are at risk?
Yes, go ahead. This is so important.
Absolutely. The American Academy of Ophthalmology provides a wonderful website called geteyesmart.org. That's GETEYESMART, geteyesmart.org, where there's a lot of information. And in particular, you can pick up a brochure and DVD called Hope in Sight that stars Diedre Hall and provides a number of tips and information resources for people with AMD. So I recommend you go there.
Well, thank you to both of you for speaking out about this really important issue. And I also want to say, Diedre, I grew up watching you. So it's a real honor to be able to speak with you today. And, of course, watched you on Days of Our Lives for many years. So appreciate you talking to us today.
Thank you so much. Thanks,
you.
Laura.
Take care. We'll check in with Ron.
Destination Weather is brought to you by Evansville Regional Airport.